Researcher. I don't like SPSS. Me too, actually. Yeah, we can see a lot of answer on I don't like SPSS. Yeah, I think most of us are looking for something which is more feasible, user-friendly type of statistical analysis tools. Yeah, this software is free. You no need to pay for expensive licensing. Yeah, great to hear that most of the people we would like to learn new things. Yeah, regardless of what is your answer for our Slido poll, I hope that everyone will have an open heart to learn new things today. And apart from knowing why are you here, we would like to hear from you also, your level of experience in using statistical software. So you have multiple choices here. You can be never used any statistical software before. You can be a beginner, intermediate users, or advanced users. Same, you can scan the QR code on your left-hand side, key in your feedback. A number of you have experience in running statistical tests, intermediate users. More than half of you. Quite a number of you are also beginners. Yeah, half of you are intermediate users. Even though, like myself, intermediate users to advanced users, I find it Jamovi is quite a handy tool. It acts as the rapid toolkits for me to run when I receive a new data set. I use it to run it to see what is the characteristic of the data set as an overall. Yeah, good to know that. So a bit on my background. I'm a public health specialist, graduated from University Malaya in 2022. Area of interest is psychosocial and mental health among the low-income group, and currently attached to Center for Health Policy for Health System Research. So we mainly conduct research to inform the policy making, and we mainly do program evaluation. We do conduct training and also consultancy. So therefore, in the era of data-driven decision-making, representation is the key. Confidence in data matters. It is not just about collecting numbers, but it's about trusting the insights they reveal and making decisions with clarity and certainty. So I give you an example. During COVID time, we have a lot of numbers which shows how many people got infected with COVID, hospitalization numbers, people who receive vaccinations. These raw numbers alone is not enough if they are not interpreted to inform and actionable insights, as these actionable insights will help the policymaker to decide whether a lockdown should be continued or continue using the PPE in the community. So timely decision making actually prevent the spread of the virus. So for you to crunch data with confidence, a reliable software is important. Why? Software actually, it helps to manage your complex data set, which is high demand and precision, beyond manual calculation. It avoids human errors so that it improve trust in results. Many researchers need efficient, transparent, and also reproducible processes. However, statistical analysis using software is not easy at all. So I would like to get your help to share your experiences in terms of, is there any barriers or challenges? Even you can share the success story of using a statistical software in less than 4 words. You can use the QR code on your left-hand side. First thing answer, always forget the steps. Complicated. Agree? Let's see. So unsure which button to tick. A lot of the statistical software nowadays, they use the graphic user interface. By right, it should help us to easily pick the test that we want to use for our data analysis. But again, it also depending on the design of that software, whether it is intuitive for the users to use or not. Don't understand the terms used. Yeah. Long code. I guess this long codes is for the syntax-based software. Yeah. Yes. It sounds like quite a bit of challenges faced by our users here. Could keep changing. Interesting. Yeah, actually, statistical analysis using software is not that straightforward by using the conventional software. So my first experiences of data analysis and using statistical software was during my undergraduate MD at UPM in year 2000, whereby I was required to conduct a research project to look at the myopia among the first-year students from the Faculty of Medicine and Health Science. That time, the SPSS version hanyalah 9. So as a beginner to statistical analysis and using SPSS, memang is struggling for me. In spite of me, went to see my lecturer 6 times, I'm still find it is confusing. Confused on which statistical analysis or testing I should use. And looking at the SPSS is quite troublesome, as it gives you multiple windows. As I can see some of you like give the feedback of is do not know which step to follow this and that, and I do agree, because even though they are using the graphic user interface, somehow or other we seriously do not know which one to choose from the software. So it took me more than 15 years to convince myself to enroll into Master of Public Health. At that time, I conduct another cross-sectional study to look at the mental health of our preschool care providers in Kuala Lumpur. At that time, SPSS already version 20. So selepas more than 15 years, And then this time, the statistical analysis is slightly difficult. I'm using logistic regression to churn out what are the factors associated with the mental health status of the care providers. So when getting into the DrPH, our project is more complex. Therefore, more complex, we need multiple methods, meaning we need more than one software to help us to analyze our data. That's the time, as a student, we are trying to explore other software to see which one is the best, can help us to settle our work fast and straightforward, user-friendly. Kalau boleh, tak bayar-bayar lah. And then, of course, so we tend to use the unlicensed software or pirated software, but that's carry some risk because of the infringement of the copyright. So therefore, whatever you have keyed in just now in the slide door is spelled out some of the information that I would like to talk to you in this slide. Barriers in using statistical data analysis using the conventional software like the SPSS, Stata, and SAS. These are the software that is common in the market, but they are quite expensive. For example, myself, I'm trying to maintain my data in Stata format. I have maintained it for the past 3 years. I have stopped doing that because it cost me about $99 per year. So this one is a student license. We haven't gone to non-student license. That one will be more expensive. And because of the cost, it's difficult for me to maintain. So I have tried to find other alternatives like Jamovi to help me out in my data analysis. Of course, you can say that I'm from NIH, so we should have subscribed quite a bit of all those like conventional statistical software. But then again, also the cost issue. For example, this year SPSS by right awal tahun we dapat the license, but I think bulan 7, I think bulan 6 masih we can't get the SPSS punya license and the under NIH. So they have advised us to cari alternative for our data analysis. So, and another thing is, even though we have learned our biostat, we know which test to do, we still need to attend some training to know how to use that software. I still remember when I was a student, I still need to pay a few $100 or ringgit just to attend a course SPSS, macam mana nak guna SPSS, which we drop. They don't have drop down menu, but somehow or other, as I can see some of the users say that tak tahu mana satu test, tak tahu mana satu pilihan you should pilih. So training and also is an issue lah. Yeah. So come to static output and reruns. What I can remember is SPSS. Memang the output is quite static, and if you are not satisfied with the analysis, you have to rerun a few times, and then you will get multiple windows or multiple outputs. And as you know that in SPSS, you need to save a few files. You need to save the spreadsheets which contain your data set, the output, and then the syntax you have. Yeah, you have 3. Actually, the whole thing is quite bulky to save in our laptop. And then some of the software, they are not so intuitive. And then the workflow, as I said, they are using graphic to guide the users, but then the whole design is it cannot flow to what you want to do for your data analysis. And in terms of collaboration frictions, I give you example. When we have older version of the software, some or other when we want to share file to your kawan yang yang other updated one, somehow or other they can't open it. Yeah. And then you are thinking of whether I should upgrade my software. For example, Stata. I still need to like pay for that. And comes to limited accessibility and remote use. So for expensive licensed software, like Stata, certain institutions, they only purchase a few licenses. So this license usually they will install in the computer lab or install in the pakar yang selalu guna. So it's like it will limit the usage of other users who need it. So this in a way that it limit our accessibility. So of course you will ask, oh tak boleh ke kita guna pirated ataupun unlicensed? Again, this will infringe the copyright because you are going to copy and do the installation in your personal laptop. So when choosing a statistical software, it is important for us to ensure that software can give you accurate and reliable results so that we can have a confidence in our data. And with the accurate data, with the proper software, it will reduce the human error in complex calculations and ensures reproducibility. And we also want a software which has efficiency in data management, because we are talking about the large data set, which is too cumbersome to handle manually. And also we hope that a software that can help us to clean, code, and process our data so that the researcher can focus on interpretation rather than manual computation. And in our healthcare research, we tend to use quite a complex analysis or advanced analysis. So the software that we want, we also hope that apart from descriptive analysis, we would like to perform analysis like survival analysis. And also the feasible software, user-friendly way is important, allow researcher to apply rigorous statistics that would otherwise be inaccessible. Another thing is important is the transparency and reproducibility. After we have gotten our results, we will do the write-up and send to the send for publication. A lot of time, but for myself, I have the experience of the reviewer asking for my final analysis data. So I have to pass them my data set plus the syntax so that they can rerun the test again and to verify our results. So this is a reproducibility. And then finally, accessibility and feasibility. As I said that we need affordable and accessible, not so expensive software for us to sustain our analysis. So here I'm trying to compare our conventional paid software like SPSS data and SAS with the open source software. So as you can see here, SPSS data and SAS, they are commonly used among the researchers or students. They have superiority in terms of security. They are safe. And also, but then the downside is they are expensive. The output from the software is quite bulky. You have to save multiple files for one project. But then when you come to open source like Jamovi, RStudio, and also JAST, basically they win in terms of the usability and feasibility. Of course, they are free of charge. You don't need to pay anything. Jamovi and JAST, they are equally good. However, Jamovi, it wins because they have a strong community who helps to update the software regularly. And also, the community also, they will churn out new modules quite often. Therefore, our focus for today actually is Jamovi. Basically, this software launched in 2017 by a group of statisticians. The person on your left-hand side actually is Jonathan Love. Together with his colleague, they have left just and trying to develop this physical software called Jamovi with the power of R. So Jamovi, its core philosophy is to make advanced analysis accessible to all researchers without any cost involved. So Jamovi, it is an open source and free software. They are using this AGPL free license. They are using the free license, which called AGPL license. And as I mentioned just now, it's backed by a growing community. So to date, Jamovi is already reached the version 2.7 in 2025. So here, Jamovi has translated to more than 20 languages. Apart from English, they have their software translated into Mandarin, Japanese, and a few more languages is still in development. To begin with Jamovi, just go to jamovi.org. Download the version for your operating system. They support Windows, Mac OS, or Linux. So when you open up Jamovi, you can see this window whereby the spreadsheet is on your left-hand side, whereby you will key in your data there. And then on top of the window, you can see a ribbon menu comprised of the variables, the data, the analysis, and also the edits. So the results panel is on your right-hand side, whereby you can see all your data analysis output instantly when you run and analyze. And then the modules for the analysis packages is just below the ribbon menu. So for the next few slides, we will go through a few core features of Jamovi. So in this window, you can see the data spreadsheet on the left-hand side. And the right-hand side, you can see the result. Both of them are visible together with results appearing live in the same window. Yeah. Any changes to the data set on your left-hand side, you will get an instant update on your result panel on the right-hand side. And then this eliminating the tedious reanalysis steps required by tools like SPSS. So here you can see I'm keying in the dependent variables, CVS, and also the covariate variable, the health literacy. And then instantly you see the result came out on the right-hand side. Yeah. So this is the simple, powerful interface from Jamovi. So Jamovi offer extensible modules. These are the statistical test packages, which you can find it in the Jamovi library towards the right-hand side of this window. So you just drop down the modules, And then you can see the Jamovi library there. And then you can pick the respective statistical tests that you would like to install in your Jamovi software. So installing a module is just as simple as a few clicks on it. So you pick and click, and it will automatically install in the analysis panel up here, just below the menu ribbon that you can see here. So this is the modules. So Jamovi use a point and click approaches, whereby you can easily point at that statistic test, drop down, and then pick the respective test to run the analysis. So point. So we go to the descriptive modules. Choose the variable you want to access. So here I also show how do you visualize your data using the histogram function under the descriptive modules. You just pick the histogram box, then the graph will just appear on the right-hand side of the result panel. And you can choose the pattern or the plotting. If you are SPSS lovers, you can just choose on the SPSS plotting. And if you don't like the color, you can change the color as well under the color panel. This is how wonderful is this Jamovi software. And then, by the way, their graph is ready to be used in your thesis or your publications, as well as the table. So basically, the result is in real-time manner, whereby the outputs will be generated immediately. So for the intermediate user who plan to switch to R, actually Jamovi is a good stepping stone. So for each one of the analysis, actually, if you want to view the R syntax or script, you just go to the right-hand side, the three dots here, you just drop down, and then you select the R syntax. So you can see all the R script for that particular statistical test. And then you can copy this script to the R Studio, and then you can run the analysis with the script. So this is R integration and syntax word in Jamovi. So basically, Jamovi works well on Windows, Mac OS, Linux, and even Chrome OS. So this is, you can download the desktop version of Jamovi in this homepage of Jamovi. So in this homepage, when you go to the document buttons, you can get yourself started with the started to learn how to begin with the Jamovi. And then they offer you, you can see blogs, forums, and the developer hubs under this homepage of Jamovi. So the latest version of Jamovi is 2.7. Okay, this is the desktop version. Jamovi also offer cloud version, whereby but this cloud version you need to pay some amounts of fees each. I think I pay around $5 just for me to use to conduct the analysis while I was traveling.
Oops.
It's
Belum ambil.
quite interesting features of Jamovi, and it's quite provide accessibility. So Jamovi is quite user friendly, and in fact, just now I've mentioned they are using the graphic user interface, whereby you just point and click and select the analysis that you want to use for your data analysis. There's no run buttons. It's all on reactive. So for me, I use Jamovi for my just to show some of this one of the research. I use Jamovi for the data analysis. So basically, this research is to look for the psychosocial risk and also mental health of preschool care providers in Kuala Lumpur, Malaysia. Basically, I have conducted multi-variable logistic regression using Jamovi. And then, so you can see here, the table is in APA format, which allows you just click on them, copy and paste in the Word documents. And then you just need to do some modification. It is ready to be published. And then on your right-hand side also, you can see the output from the logistic regression. So after you have then done the analysis, straight away in the same panels, you can see there's an assumption check, the model fitness test, and also the model coefficients, whereby it is, you no need to like do like in SPS, whereby you have to like find out which test or assumption check you need to use for your data analysis. So crunching numbers with confidence is not only about numbers or data, but also about using the right software that is accurate, efficient, and also feasible within the research context. So I will end my session now, and hopefully I'm able to motivate you to use the software. If not, you may listen to my colleagues for further information of Jamovi. So I will pass over to the next speaker.
Okay, thank you very much, Dr. Wong, for the insightful presentation. I really appreciate how Dr. Wong brought us back to the basics of data analysis. where we talk about the common barriers that researchers often face, and it shows us how clearly how Jamovi can overcome these challenges. And I think that is a insightful and a perfect way to set the conversation today, or set the tone for today's session for the subsequent sharing session. So for the next slot, we are pleased to have with us Dr. Rowena John, Public Health Medicine Specialist from the Seremban District Health Office, who will share her experiences applying Jamovi in the public health practice. So Dr. Rowena John holds a doctorate in mixed method on youth sexual health, and transitioning from clinical and public health, she uses Jamovi for analysis and has presented locally and internationally. She recently completed a digital leadership program, gaining exposure to artificial intelligence, machine learning, and digital health. And she is currently actively advocating the utility of Jamovi to her PKD subordinates. So with that, let us now welcome Dr. Rowena John. Dr. Rowena, the screen is yours. I think you need unmute your mic, Doctor. Can you unmute your
hear me
mic?
now?
Okay,
Can you hear
good.
me?
Yeah.
Yeah,
Yes,
because I'm
yes,
together
we can
with
hear you.
Esther actually.
Okay, we can hear you. Clearly. Thank
Yes,
you.
get it. All right, so thank you so much, Dr. Fitri, for the kind introduction. I'd like to just thank Unit Kesihatan Digital USM, Dr. Esther, for this time to actually give me an opportunity to just share my experience in using Jamovi at the ground level. So a little bit about myself. I'm Dr. Rowena. All right, I'm a public health medicine specialist at Seremban District Health Office. I come from a background of, I won't say I'm a data person. So I think you guys here, you're not a data-driven person. I think hearing from me, you'll be very motivated to use Jamovi. Yeah. So basically, I completed my doctor in public health in UM, and I also recently completed a certificate in digital leadership in Asia Business School, giving me an exposure of AI and digital leadership. So why I'm here today is actually not to teach, not to guide. I just wanted to share y'all an experience on using Jamovi. So I believe I was told that most of the participants today are students, DrPH students and master students in various universities. We as a team welcome you all for this session. So Jamovi is a tool where we can actually explore, and it's very user friendly. So I will be sharing based on my experience, right? Okay, so we will go to a few topics. All right. What is Jamovi? All right. I told my boss I'm giving a talk on Jamovi. He was asking me, what is Jamovi? Then I'm like, okay, join the courses, boss. Yeah, so getting started with Jamovi, core features, why Jamovi, and application in healthcare setting. All right, so what is Jamovi? All right, so Jamovi is actually statistics made simple. Jamovi is a new third generation statistical spreadsheet designed from the ground, easy to be used. Jamovi is a compelling alternative to costly statistical products such as SPSS and SAS. And the best part of it is Jamovi has an R integration. So it's actually built on top of our statistical language, giving you access to the best that statistic community can actually has to offer. All right, and it's free and open. Jamovi will always be free and open. So during my doctorate, I actually go to this website to actually learn, because at that time, we didn't really have any lecturers teaching us on Jamovi, but I wanted to explore something new, because I felt SPSS was too heavy for me. I mean, the whole software macam berat. I feel it's berat for my laptop. So I wanted to learn something new. I felt R was too high-tech. So I was somehow exposed to Jamovi, and I started exploring this tool. So getting started with Jamovi. So just want to welcome to the documentation for Jamovi, a free and open statistical software to bridge the gap between researcher and statistician. So why Jamovi? All right. Jamovi is a free and open source. So the best part of the software is it's free. All right. That is the best part. And it's free download. We can easily download it from the jamovi.org. It's a very user-friendly interface. Yeah, I remember when I first started using Jamovi, I felt that it was very user-friendly. I didn't have to crack my head much, just use the guidelines that's given and I can actually blend in together. And it is also very versatile and flexible. It's ideal for teaching, all right? It's very good for, it's perfect for educators teaching on statistics actually. Yeah. So if you want to download Jamovi, like Dr. Esther mentioned earlier, we can always go to the website and you can check out about it. All right. So if you go to the website, I just wanted to introduce you all about the website. So if you go to the website, you tekan at the DOC, document part, it will keluar all these things. You know what you see on the screen now? If you see on the left side, it will come out all this, all the analysis, overview, descriptive, t-test, you know, and ANOVA, linear regression, logistic regression. And actually, if you scroll downwards, you can actually see it much more further. And on the right-hand side, they will, if you don't have Jamovi installed in your laptop, no problem at all. It's very easy to be installed in your laptop. And they actually guide you on the steps of installation for Jamovi. So I believe it's very easy for any of us. I remember the first time when I downloaded Jamovi, I was like, oh, as simple as that. Yeah, so it's very easy. So I thought of giving you all a little bit introduction of the interface because today's session is more to sharing and we can't go in too much on the technical knowledge part. So I thought of introducing to you all on the interface. So after you all download Jamovi, you all will get this as your interface. Okay, so when you look at the screen, you see something on the left and on the right. Left is where we see the spreadsheet view and the right is the result of the statistical test. So basically, if you don't have any variable on the left side, nothing comes out on the right side. All right. And if you look at the interface here, after download, your Jamovi is very basic. Tak ada apa-apa kat sana. If you notice, there's only exploration, t-test, ANOVA, regression, frequency, right on the top above. But if you notice, if you saw Dr. Esther's Jamovi just now, there's so many things after the frequency. All these are additional modules that we can easily attach based on what you need to attach. Yeah? All right. One thing about Jamovi is we can import data set easily into Jamovi. So for example, you just need to go the 3 dotted line on the left side, and then you just need to open and you can actually choose in Excel format and it will be automatically inserted into your Jamovi. Yeah. So that is something very convenient that we can use Jamovi for it. So just a little bit of basics on Jamovi on how we can perform descriptive analysis. So if you open the Jamovi interface, if you go to analysis, all right, if you go to analysis part, you go to exploration, you just tekan descriptive. Yeah, you just tekan descriptive and then you can masuk your variable. For example, you got variable gender, age, but you want to see how many female is how many years old, you know? So you can split it by that variable. You can actually split. So this is how the changes will look like. Yeah, all right. So this is an example that at the district, I actually shared and taught a few medical officers on the use of Jamovi and we went very, very basic. So if you put in your data on the left side, so on the right side, it will come out like this on the results part. All right. And then we can also click the frequency on the left side, the sample size, central median, depends on whatever that you want. And one thing nice about Jamovi is it will come out clearly on the right side. You can see preventable deaths, how many percent, unpreventable, how many percent. It will auto live update your data. All right. So for example, here we can see on the right side, the preventable, unpreventable, it will actually come out automatic as we analyze it gives you live updates. So just thought of showing a little bit of logistic regression. How do we perform logistic regression? One thing about these icons, maybe the more you all use Jamovi, you'll get more familiarized with all this symbol. Like this ruler shape is usually a continuous variable. This round ball shape is usually categorical. Yeah, so usually when you want to perform logistic regression, it goes back to the analysis. You tekan regression, all right? And then depends if you are performing a binomial, you tekan binomial. Yeah, okay. And then you can put in as dependent, whatever that you want to put in as your dependent variable, your predictor to your covariates, right? So as you update on your left side, your right side, it will start appearing like this. It goes based on the model. Yeah, all right. This is an example. So what are the core features of Jamovi? First is user-friendly. It's very, very user-friendly. I never really had I never really had like classes on Jamovi or something like that. It was like the website, and then we used to work together, me and Esther, we used to exchange our thoughts with Gihan as well. That's how we actually learn. So trust me, it's very, very user-friendly. Just try downloading it and you will see what I'm trying to say. Second, descriptive statistic and visualization. One thing nice about this is on the left side, as you describe, it will automatically clue on the visualization. Yeah, all right. And third one, data management. We can import data from any of these formats, all right. And then we also can perform exploratory analysis. Of course, we can also do inferential statistic. Like just now I shared on the interface, there are a few of these statistics analysis based on what kind of test you want to do. And you can also reproduce, and it's very transparent. And Jamovi is a very good tool for that. And the best thing is we can add extensions to the current Jamovi. If you feel you want to go on deeper analysis, deeper modeling, that is where we can just simply attach it under the module section. Okay, so I used SPSS in my master's, all right? And I felt that like I said, I didn't like it was because I feel it's berat for my laptop, so I explored. But what are the key differences? So first is cost. If you want to compare SPSS and Jamovi, SPSS we have to pay, the licensing we pay, but Jamovi is free. Yeah, all right? User interface SPSS is menu driven, all right? But Jamovi is clean. Like we shared earlier, on the left side, you can key in your variable, right side, it will auto live update, all right? The engine behind SPSS is IBM software, but Jamovi is actually on R. The flexibility, SPSS is limited, but Jamovi, we have a community-driven extension. We can add on whatever deeper analysis that you want to do. All right, reproducibility, syntax is optional, but in Jamovi, it auto updates and we can actually export the art syntax. Graphs and output, SPSS is a bit clunky. Jamovi is APA style and is actually publication ready, the graphs that we produce in Jamovi. Accessibility, SPSS is license required. Jamovi is cross-platform and is free download. Target users, SPSS is mostly for academia and business institutions, but Jamovi is very suitable for students, educators, and researchers. How about Jamovi and R? Yeah, because lately I've been exploring on R as well, and I realized that in Jamovi, it's very graphical user interface, but R is actually a programming language for statistics and analysis. So in Jamovi, like I shared earlier, you just need to click, and with time, you can actually learn the software. Yeah, but in R, we need to know coding knowledge for scripts. And for Jamovi, it's limited to built-in analysis and modules. R is extremely flexible, endless packages. For Jamovi, we can do extensions. If you want to add on any further analysis, you can add on into Jamovi. R is thousands of strand, yeah, by conductor packages. Reproducibility, I think both is basically reproducibility. Learning curve, Jamovi is easy, no coding required. But R, we need to have that programming skills to be able to do R. Jamovi is smaller, and most of the studies that use Jamovi in our papers are usually moved towards education and health research. But R is a huge global community. R is also a program that is very upcoming. A lot of people are using R. It's a huge global community. Yeah. Jamovi is for teaching quickly applied. If you want to retest the data, Jamovi will be a very good tool. But R is advanced modeling. So I just wanted to share a little bit on a study that I actually presented using R, and I presented in Korea last year. So it was actually a mixed method study. It's utilization of sexual reproductive health services among youths in Malaysia, a mixed method study. So I used a mixed method study for this research, and just wanted to share a little bit of sharing experience of the study. So sexual reproductive health includes antenatal, delivery, and postpartum, as well as information and access to counseling, health education, family planning services, HIV testing, and diagnosis. So basically, around this study, we actually want to see the proportion of Malaysian youths who are aware of the availability of SRH services and who utilize these services and identify factors and barriers that affects this service utilization. So the study focused on age between 18 to 24 because these are the age that require and seek sexual reproductive health service utilization. So Anderson healthcare utilization model was used to conceptualize the potential factors. All right, so it was a two-phase study. First was a cross-sectional study. So in this cross-sectional study, we basically got about 617 respondents. And I actually used Jamovi and I used multiple logistic regression for this part of the phase 1 study. Yeah, so from there, from the phase 1 study, we actually did a descriptive study, knowing what are the characteristics of the participants. So in total, 617 participants from 13 states and 3 federal territories was participated in the survey. More than 50% were unaware and only 20.4% utilized. So the older age group were more likely to utilize the SRH services, and marriage participants are most likely to utilize the SRH services. And group of participants who had obtained information on SRH from family members were more likely to utilize SRH services who did not use. And from there, I used a multivariate logistic regression, producing this second table where I see the factors affecting SRH utilization. So from here, there are few factors under predisposing age, marital status, high-risk behavior, exposure of information, and enabling factors and hint factors. All these final model, Cox and Snell, AUC predictive measures, multicollinearity was checked, and all this was easily done by Jamovi. So I think it's a very, very easy tool to be used in our study. And of course, my study after that, I further went into qualitative, where I looked at the barriers. So from qualitative, these are the 5 main barriers that was. I never thought that I would be able to present at an international level. And I remember that when I presented it, one of them actually asked me that, what is this statistical tool about, this Jamovi thing? So I know there was something new that was coming up. And I thought my story will end here. That means after my DrPH, that's it, I'm closing. Because like I mentioned earlier, I'm not a data person. I don't see myself analyzing for a long term and all that. But lo and behold, when I went back to my district, I realized that there are so much of data and there's so many things that can be done. So I wanted to empower my colleagues at the ground level to actually do something. And I started introducing this Jamovi to whoever that is willing to learn. So I actually introduced, we never really had a workshop or anything, but I was kind of glad that it can be translated back to the ground. Yeah, so this is Dr. Farah, one of our medical officer who actually presented at the UKM Public Health Conference. So it was a descriptive study, but she actually was exposed to Jamovi. And from here, we can see that in Seremban District Health Office, when we review neonatal deaths, we can see that majority of them, we have seen that hypertension is shown to be one of the highest risk factors among mothers of neonatal deaths. And there's an increase of 8.2% of mothers in 2022 to 2022 to 22.3% in 2023. So the study identified hypertension as one of the high-risk antenatal factors contributing to neonatal deaths in Seremban district. Yeah, so this is just something that I was glad that we could translate it down at the district level. So I'm coming towards my end. So Jamovi may look unfamiliar at first, but like every tool, the more you explore, the more it empowers you. Don't worry about being an expert on one day. Just take the first step and the rest will follow. Remember that every pro was once a beginner who dared to click open. So this is my boss, the Jabatan Kesihatan Negeri and my Pejabat Kesihatan Daerah Seremban. Kind of glad that they give me opportunities to continue empowering colleagues. So just wanted to share to everyone here today, wherever you are, you can empower yourself and also your colleagues and friends. And just wanted to end the session by encouraging all of you all who are especially doing a doctorate and masters, do not give up. If you don't know, go and find something. Go find colleagues that can help you, attend workshops, learn whatever you don't know, you learn, because we can do something about it. Yeah. Once upon a time, I thought I would not be able to complete, but suddenly I'm like, you know, able to complete, and suddenly I see myself teaching other people. So it's like very irony. Suddenly I'm with Esther and we are giving talk on Jamovi. So just now we had lunch together and we'll be like, okay, today we're giving talk on Jamovi. Very interesting. Yeah. So these are the things I'd like to just encourage all of you all who are doing your studies. I wish you all the best. Don't give up. You will all make it and you will continue empowering your colleagues and friends. So I encourage anyone who would like to connect with me, you can just drop me a quote, drop me a call, or you can connect me with LinkedIn and drop me an email. If you want me to guide on some basics, I'll be very much gladly doing it. So I'd like to end the session by saying Jamovi is not just a software, it's a bridge between research and real world healthcare impact. If you don't try it, you will not know it. So try it and see how it goes. I wish you all the best. Thank you.
Okay, thank you very much, Dr. Rowena, for such a practical and hands-on sharing. So we truly appreciate how Dr. Rowena demonstrated clear and applicable ways of using Jamovi in real practice. So it makes it easier for us to see how this tool can be directly applied in our own work. So we move on to our second sharing session, our third slot for the day. So it is my pleasure to invite Mr. Ng Yit Han, a PhD candidate at the Department of Social and Preventive Medicine, Faculty of Medicine, University of Malaya. So Mr. Ng has exhibits a strong dedication to the fields of biostatistics and epidemiology and has guided numerous postgraduate students in their data analysis since 2016. He is proficient in statistical software, including SPSS, Jamovi, and R. So Mr. Ng will be sharing his perspective on how Jamovi supports academic and research endeavors. So without further ado, floor is yours.
Thank you, Dr. Victory. Let me share my screen. All right. Can you all see my screen?
Yes, we can.
Okay, right. Great. Okay, thank you. Good afternoon, everyone. Before I begin with my sharing session, I would like to briefly introduce myself. I'm Yit Han, a PhD graduate in public health from UM, who majoring and specialization in biostatistics and epidemiology. Since 2016 and 17, I've been participated in guiding postgraduate in their respective project, particularly in their data analysis. So throughout this period, I've been exposed to several statistical software such as SPSS and R. And just in recent year, Jamovi was introduced to me as an alternative statistical software by my colleague. So I'm grateful today to be given an opportunity to share some of my experience in data analysis using Jamovi in comparison to other statistical software such as SPSS and R. Okay, before I move on to the content, I would like to declare my disclosure whereby the point I will be sharing are solely based on my personal opinion. So others may have totally different perspective and opinions, especially those who are already comfortable with the existing analytical software they are currently using, right? So let's move on to the content. These are the three main components that I would like to highlight and share today. I'll begin comparing the features of the software, followed by individual feedbacks on Jamovi, in their respective data analysis, and last but not least, my personal views on the Jamovi software itself. Without further ado, let's move on to the first component, the comparison features of SPSS, Jamovi, and R. I believe that Dr. Esther and Dr. Rowena just now has shared some comparison between the software. I will try to recap it and edit more points that they may not highlight just now. So this table generally summarizes the 6 features between the statistical software, which comprising of user interface, learning curve, CPU and GPU demand, add-on or plugins, result presentation, as well as costs. Regarding user interface, SPSS and Jamovi interface are generally user-friendly compared to R, which is purely coding basis. Therefore, SPSS and Jamovi are comparatively easy to learn than R, which has steep learning curve for the beginners. So in terms of CPU and GPU demands, SPSS is relatively heavy to run and can be sometimes laggy, especially when you loaded it with a huge dataset. On the other hand, Jamovi is less demanding on CPU and GPU resources compared to SPSS. But out of these 3 software, R require the least, probably requiring no allocation of CPU or GPU resources on the simplified user interface. For plugin or add-on installation, SPSS user may encounter difficulty in navigating the newly installed plugin compared to Jamovi, whereby the analytical add-on will appear right above the analytical panel once the installation is successful. Installation packages in R is relatively easy but requires some simple code. In terms of result presentation, both SPSS and Jamovi have good graphical presentation. However, SPSS requires more steps for certain analysis such as assumption tests for regression modeling. On the other hand, R can produce sophisticated, eye-catching, and highly customizable output, but again, it requires some coding. Lastly, SPSS is not free, whereas Jamovi and R are free and open source. So let's move on to the second section on the individual feedbacks on Jamovi. For your information, I will be using simulated data to demonstrate the analytical output by this software, mainly because some of the result output from the individual are still under review. So let's move on to the first example, whereby individual A looked at the factors associated with gestational diabetes mellitus patient. By using the Jamovi, the individual A was amazed by the clean user interface of Jamovi. Besides, this software also allows the user to change or swap the reference group easily and in the step, instead of required to recode the designated reference group like SPSS. In addition to that, Jamovi also allows the user, in this case individual A, to test the model assumption as well as plotting the ROC curve immediately after conducting the regression model within the single analysis itself. This slide displays some of the example of logistic regression modeling interface in Jamovi. The picture on your left displays the factors included in the logistic regression modeling. Pay attention on the red circle that I highlighted, indicate that how Jamovi allows the user easily switch between the reference group. In this case, you can easily swap the economical status from B40 to M40 or even T20 by just simply clicking the button. And the result will synchronize immediately. The picture on your right illustrates the ROC curve along with the estimated area under the curve. Comparatively, in SPSS, we usually need to save the predicted probability, in this case logistic regression predicted probability, and run a separate analysis in order to plot the ROC curve using the classify function. So let's move on to second example, whereby individual B provide her feedback on the validity of a questionnaire. By using Jamovi, the user able to run parallel analysis in addition to traditional exploratory factor analysis for domain identification that rely mainly on eigenvalue itself. By using parallel analysis, individual be able to strengthen the stability of domain identified throughout the study. In addition to that, individual be also able to conduct reliability as well as confirmatory factor analysis using the same add-on in Jamovi. For your information, SPSS users are required to install another software known as AMOS by IBM to conduct covariance-based confirmatory factor analysis. Let's move on to the next slide on the result output of exploratory factor analysis. From this slide, we can clearly see that the related item will group into 3 domains that circle in red, and this is supported by the parallel analysis script plot on your right. As far as I'm concerned, SPSS users are unable to conduct parallel analysis in the default SPSS setting. So an additional syntax may be required in order to do so. Let's move on to the last example, whereby individual C gave a feedback on mediation analysis using Jamovi. Generally, individual C want to investigate the mediation effect of BMI and waist circumference on diet towards HbA1c level among patients in a hospital. Jamovi allow individual C to present either a conceptual or statistical path diagram easily. In addition to that, the result tables on indirect, direct, and total effect is structured in API A style, which is an academic table. Therefore, individual C can easily import back the table result back to her Word document. Move on to the result section, the mediation analysis result. This slide displays the path diagram and the result table of mediation analysis. By referring to the table, we can briefly see that waist circumference was found partially mediated the effect of diet. In this case, it's proxy by healthy eating index towards HbA1c level among the patients. Since this sharing session is mainly demonstrating the Jamovi features, I will not go very in-depth on the result interpretation itself. On the other hand, SPSS users are required to install process macro to run similar analysis. Despite Prof. Hayes have done his tremendous work in SPSS in developing the macro, SPSS users are required to extract the information manually throughout the output. So let's move on to the last section. My personal opinion on the Jamovi. So the question is Jamovi the best among the 3 software I highlighted just now, which I come across? Well, the answer is every software has its own strength and limitation. Jamovi, no doubt, is a lightweight software, and when coupled with its user-friendly interface, this software allows the user to analyze their data without any hassle. However, from my experience, Jamovi have no straightforward way to sort the data easily like SPSS, especially in the ascending and descending form, which commonly done during our exploratory data analysis, or commonly known as EDA. The only plugin that come across which allow you to do so tends to save your data into another dataset, which defeat its convenience in data structuring and cleaning while using Jamovi. As for R user can freely do meticulous data structuring and wrangling and advanced statistical analysis, but this requires some extensive coding skill. Since nowadays, the large language models such as ChatGPT, Gemini, or even Claude improve drastically, and most of them can effectively help in coding, I personally think that this can ease R user from getting frustrated due to error while using R. Lastly, there's still room for improvement for Jamovi. I think Jamovi as a free and open source software deserves to get more attention from students, researchers, as well as academicians. By doing so, the Jamovi developer will get more feedbacks from the user and probably will develop more sophisticated and advanced statistical features for this software in the future. These are references for each Jamovi plugin that I shared in the second section, individual feedback just now. Yeah, that's all from me. Thank you for your attention. Back to you, Dr. Fitri.
Thank you very much, Mr. Ng, for that very engaging and practical session. I like how Mr. Ng showed us not just the technical aspects, but also the humans behind the Jamovi, which is the real researchers, real research applications, from questionnaire validation to generating API style outputs. So it really highlights how Jamovi not only powerful, but also convenient for researchers, especially for us who don't have extensive coding needed for our studio. So thank you very much again. So we are going to our next and final slot, which will be delivered by Dr. Marhaini Mostapha, a research officer from the Institute for Health System Research, NIH, Ministry of Health Malaysia. Dr. Marhaini holds a PhD from UKM and has led research in economic analysis, evaluation, and healthcare optimization, and formerly a postdoctoral researcher at the University Technology Petronas, UTP. She recently published clinical work on in-hospital cardiac arrest using Jamovi Software, and she looks forward to sharing her experience. So I would like to invite Dr. Marhaini to give her sharing. The floor is yours.
Assalamualaikum everyone. Assalamualaikum and a very good afternoon, everyone. First and foremost, thank you, Dr. Fui, for the kind introduction. And thank you also to Dr. Esther for this kind of opportunity for me to share my experience in using Jamovi. My name is Dr. Marhaini. I'm a research officer from the Institute for Health System Research and IHSR. And it is my pleasure to present today on Jamovi experience in research. For today's session, primarily, I will share my experience using Jamovi and particularly on survival analysis from my recent publication in PJ Journal, which is in hospital cardiac arrest, survival status and its determinants in Malaysia public healthcare, which is just published on last June. So this work is actually a part of our research collaboration with Hospital Pulau Kenal as one of the referral center due to the availability of advanced resuscitation team. So if you can see on the right-hand side, so on the right-hand side is actually our front page of our published manuscript by using the movie and also incorporated also with startup. So before that, I give you a bit of background of this paper. Is in hospital cardiac arrest is a life-threatening emergency that occurs within hospital, which is globally survival rate is varied in between 15 to 39%, which is remains a significant clinical challenge despite even we have an advanced resuscitation team in critical care. But in Malaysia itself, however, the data is very limited. We do not yet have a national ICAR registry. So this evidence is important in order to evaluate and improve our ICAR survival status. And this is why we conduct this study in our tertiary public hospital to measure the survival rate and to explore the key determinants that influence the survival. So understanding this can help to guide future policy and practices. So our main objective here, which is we have two. The first one is to assess the ICAR survival rates in tertiary public hospital and also to identify the determinants which is influence the survival in terms of clinical, demographic, and event related. Okay, so this is actually the whole summary of the study and output, which is the study design of this research is a retrospective cross-sectional study. We are using the secondary data. It's from ICAR registry in our hospital. And then the setting is in Northern Tertiary Public Hospital. It is a 1-year data, which we managed to get sample, which is around, sample size is 934, which is inclusive the adult cases, CAR cases. And analysis, we are using Kaplan-Meier survival analysis
from Jamovi, and then logistic regression for its determinants, and also based on the state template reporting. So if you can see, so we can get the descriptive of the social demography in terms of mean age, gender, location of ICA event. This is from descriptive analysis. And then for the shockable rhythm, non-shockable rhythm, so this is all we can get from the descriptive analysis lah, from the Jamovi or other stata data. So if we can see, so in averagely, the successful of RSC from this study is 43.5%. And then at the end of the study, only 6.4% of survived to discharge, which is with a good CPC 1 and 2, which is 45%. So we can consider it's still low lah, despite of 43% of success results. So if you can see in the red box there, so the red box is where I'm using Jamovi for the output of the publication, which is we plot the survival curve by using Kaplan-Meier estimate for overall cases. And also we can get the survival analysis, which is the survival median time, survival rate at day 1, day 7, and day 30. And also the significant factor associated with ICA. We have 3 significant factor, which is location, shockable cardiac rhythm, and also CPR duration. Okay, so if you can see, sir, I'm sharing here, this is the basic step that how I'm doing the survival analysis by using Jamovi. Okay, so if you can see on the right hand side, there is our interface. So this is after I plug in all the data, upload, prepare the data set in Excel and CSV format. So you can instantly upload to the data, and then my duration time is survival time is I'm using in hours, or also can use in days. My status event indicator, 1 is for deaths and 0 is for censored. And my predictor determinant is I'm using age, gender, location, arrest witness, cardiac rhythm, adrenaline, CPR ratio. And the variable for calculation, we can include time or date for admission, initiation of resuscitation, certificate of death, and discharge. And the outcome that I measure is the patient survival to discharge, which is success ROSC. It's more than, success of ROSC is more than 20. Okay, so if you can see from the left-hand side, so that is how we report the methodology by using the Jamovi, which is survival status was coded as 0 and censored not deaths, and 1 is dead if event occurs. And the Kaplan-Meier survival curve was plotted using Jamovi. So during our analysis, is actually last 2 years. So Jamovi still 2.3 version for visualization. And then this is how we declare after we using certain software. And then it's simply you can click. Second one is how you analyze the Kaplan-Meier analysis setup. You can just straight away click the analysis, click survival and Kaplan-Meier. Then you can assign your time and status variable. Like if needed, you can also add a grouping variable such as location of arrest, either ICU versus ward or CCU, ICU you can group together, and ward you can compare with ward. And then the output is included in survival curve, median survival time, log rank test for group comparison. Okay, so if you see the drop down from the survival analysis, you can see 5 types of analysis that you may choose under survival analysis in Jamovi. The first one is the types of clinical part survival. The first one is survival analysis, which is mainly to study how long or something happened. Let's say how long the deaths happened, how long or recovery or relapse time. And then for example, how long the patient survived after the cardiac arrest. This is based on my case, yeah. So different data might have a different example. Okay, so for continuous variable survival, the first one, either you want to check a number, such as the age or blood pressure may change over the survival. And for example, do older patients die sooner? Okay, for the third one is multivariate survival analysis. So this is how you look at many factors at once to see their independent effects between the survival. And then the example, let's say you plug in age, ICU versus what, shockable, non-shockable rhythm, and treatment speed, how fast you give the adrenaline CPR ratio. So this is, you can analyze using multivariate survival analysis. And then next, you can see the odds ratio and table plot, which is odds ratio is compare the likelihood in between the group, which is the table plot shows the OR values with uncertainty. And for example, patient with shockable rhythm has 4 times more likely to survive. This is what our finding show from the analysis. And then for single arm survival, it looks at survival in one group only with no comparison. Let's say in our sample, we do not have comparison in between different hospital or healthcare facilities. So only at one hospital. So we are using single arm survival. Okay, next, after we analyze the survival, and then we go to Kaplan-Meier output. So this is the sample of output that you can get from survival analysis, which is the first one as shown by Dr. Esther and Dr. Rowena and the team. So we can see the descriptive first. So you can see here the number of sample, and then is there any missing data? What are the mean data? What are the median, standard deviation, mean, and max? So this one you will report on your table, descriptive table. And then at the median survival table, so you can see the median here is 0.75. That as our paper, we need to point out up until to 1 decimal places, so we report as 0.8. And then the output for 1, 3, and 5 year survival summary table. So this is the interesting of survival analysis, which is you can set, let's say for our study, we want to see how many number of patients at risk, how many number of event mean deaths happen, how many % of survival that patient that can survive throughout the study. So what you can choose here, this one you can modify. Here I'm using time in terms of hours. So 24 hours is day 1. 168 hours is day 7, and 720 is day 30. This is based on the revision with our reviewer from the publication. Okay, so you can see how many at day 1, 141 people are now at risk. Number of events, so now we have 786 people at deaths, and chances of people that survive only 50.4, and it's going down as across the time. Okay, so this is the survival plot based on the estimated for overall ICA cases using the Jamovi. So this one you can simply copy and paste from the output on the right panel. Okay, so the curve show the probability of survival over the time. The steeper the curve means the worse the survival. As you can see in day 1, it's already steep curve down. So we can see more than 80+ % people has not survived after day 1 of the ICA events. And then at 7 days, so we can see also from the table itself, so about 8% only that survive, and at day 30, so it's rapidly declined to 3.6% only survival. Okay, so next we move on to the Cox regression setup, which is we want to see the odds ratio and hazard ratio of the study of our determinants, which is for the second one objective, which is in Jamovi, it's under analysis. You can click on the survival and you go to Cox regression, so which is the third one. Here you go, you can specify your time and status, but also to add other covariates such as location, rhythm, adrenaline, or age. So it's based on your module. And then the output, it will include hazard ratio with confidence interval. You can see CIs, minimum, maximum, and also the p-value from the output. And this allows us to see which factors independently predict the survival. So our result in this analysis, some key determinant that stood out, which is the first one is shockable rhythm. shockable rhythm, which is patient with shockable rhythm had much better survival chance. With the hazard ratio was 3.8, and the ICA that occurred in critical care location, which is in ICU or CCU, had a better outcome with hazard ratio of 1.9. So patient who received a ratio of 1 milligram every 3 minutes or less had improved the outcome with hazard ratio 3.5. So this is the third factor that influenced the survival rate. So this finding is actually consistent with other international evidence, with the strengthens the validity of our results. So after you've got the univariate and multivariate, so you just simply export the data, you click file, export, and you can transport in form of PDF, Word, or HTML. Or it's also, as mentioned by Dr. Esther, it allows you to download the R syntax and export and continue analyze at R. So this is example of the interface. So interface of the analysis. So if you can see, this is the multivariate survival analysis. So this is all on the left-hand side is the data from the one that we upload, the variable. And then here, time elapsed, I put it is a time, which is start from the resus until it discharged or deaths. And then the outcome is in 30 days. And then, for example, explanatory variable, we can add witness arrest, arrest location, and shockable rhythm. So at the right-hand side, you can see the output in multivariate survival analysis. So it can straight away show you what are the univariable and the CI and also the p-value, and also the multivariable, the CI and p-value. Okay, so this is the example of our original result. So since this one is publishable, so I can share to you all. So if you can see, this is all the variables. And then this is the percentage from descriptive analysis, survive and discharge, the odds ratio. So this one is from the Cox analysis, and then the chi-square and also the p-value. So the one that significantly p less than 0.25, sorry. So we move to our multivariate logistic regression. So we can get the model for the significant, and then we can further see the p-value, which is location of ICA event occurs, first documented cardiac rhythm, which is shockable, and also CPR adrenaline dosage ratio, which is less than 3 minutes, which is per 1 mg. So this is the most three factors that influence, significant factors that influence the survival of our patient. So if you can see, so this is to determine the survival. For example, the result. So the positive predictors is occurs the critical care area, shockable rhythm with adjusted odds ratio, CPR adrenaline duration. So this is the three factors that I mentioned before. And other observation also, you can also include what are the factors that affects causes of death of the patient. And also our median survival time is 0.8 hours. So the conclusion and implication of this study, and also by using Jamovi to help to analyze the data. So the overall survive to discharge is our public setting is still low, 6.4%, despite we have a moderate return of spontaneous circulation with 43.5%. So the determinants were identified and has clear implication on the practice and policy, which is to improve early recognition and monitoring, especially in general ward, and strengthen the post-resus care in ICU, and importantly, to establish a national ICA registry so that it can be standardized and used for future planning and policy. So this is how Jamovi supports the survival analysis, which is it helps us in order to plot survival curve easily throughout the menu. And then it helps to estimate the survival probability at different time point. So you can adjust the time point based on hours or days that you want to analyze, and allow comparison in between group treatment and control. And then it allows you to run the log rank test, proportional hazard regression, to model the effects of predictors to your survival time, and also you can provide a hazard ratio and time to event data handling, visualization, and it can able to integrate with R, which is you can use via RJ editor. So this is my also I want to discuss. This is my personal view also based on the application using Jamovi. There are some no software that are perfect. So there are some advantages, and I think there are some also limitations. So I will share. This is particularly on survival analysis. Okay. So advantages, it's easily available as mentioned before by our speaker. It's free open software. It's just the limitation. It's a community-based R and Python, few survival-specific tutorial, and the user interface is very friendly user. And limitation is just the workflow may limit the flexibility of the advanced or custom analysis. Let's say you want to custom a different analysis, so I suggest you to use R. Okay, and then for statistical methods, provide Kaplan-Meier survival curve, it's able to run log rank tests and Cox proportional hazard models. And then, however, it has a few options on the R data, source, and other. And then the best is that it's able to help you to generate a clear survival plot, hazard ratio table, and summarize with minimal setup. And it able to help you in easier for students, in health researchers, which is if you are beginners. So I would suggest you to use this Jamovi for analysis because it's require a very minimal code compared to other statistical software. And then the reproducibility, so far, once I run the analysis, survival analysis, and also Cox regression, compared using Jamovi and also R and Stata, so the result is consistent. There are no significant difference. Let's say if I run the Jamovi, it's different, run kat Stata is different. So far, the result is consistent. Okay. So from my research perspective, I would say Jamovi is very helpful. It's easy to use even for beginners and provide a clean output for Kaplan-Meier and Cox regression, which this survival plot and hazard ratio table can be exported directly into your report and presentation. And the most important thing is publishable. This I've already shown you the evidence. So however, for more advanced model, such as variety or computing of risk, so Jamovi has some limitation. In those cases, you may need to switch to R or other specialized software. Still, for most teaching and applied research, I think Jamovi is still a practical tool. Thank you.
Thank you very much, Dr. Marhaini, for the very comprehensive and impactful sharing. So we can see how Jamovi can handle complex methods like Kaplan-Meier and Cox regression, and also while producing the clear publishable results. So it's very flexible and very adaptable to multiple situations involved in the research. So we are coming on to the Q&A session. We have finished with the sharing session for today. So we will now open the floor for any questions for our speakers. So you can ask the chat box, or you can raise your hand if you want to speak verbally. So while waiting for any questions, so I have a question for Dr. Wong or any speakers. So my question is maybe to Dr. Wong. Do you have any tips for someone who is just starting to learn Jamovi? And also, would you also recommend beginners to eventually explore R alongside Jamovi? And if so, at what stage?
Okay. Thank you, Dr. Fitri, for your questions. Basically, for myself, when I was a beginner, just started to learn Jamovi, I just went to YouTube. It takes about like 1.5 hours for you to familiarize, just to get some basic. Then you can start running your data set of everything. Because Jamovi is so friendly until it's a self-explanatory software. Basically, you number, you tell what is the next step. So meaning after you run the test, the assumption check is already there, the GOF is already there. So you just tick the box. So along the way also, that software also teach you statistics. Yeah, that's my answer, a bit of tips. And then at the beginner, whether we should encourage them to learn R together with the Jamovi. Of course, you will learn the script based on the statistical test that you run in Jamovi. But again, I think for our language, you still need some guidance from the start. Yeah, that's at what stage I think there's no harm if you can do it concurrently with the R language. Maybe my colleagues can give their insight on this.
Okay, let me share. Actually, I just learned Jamovi, I think within a month with our Sifu, so Dr. Esther. So it's quite friendly using. Guna tersenang lah. I mean, so just upload, make sure your data already clean, and then you straight away click, analyze. And the important thing is that you know how to read the data, because we have to plug in several model. So we have to see which one the significant. So until the multivariate. So that one, I think as long as you are willing to learn, so it's not that hard lah.
Basically, I'm an active user of Jamovi. While running Jamovi also, I will try to verify with other software like Stata. Is consistently doing this. So the estimate that I find comparing Jamovi and other very popular software like Stata and SPSS, there's not much different. The data is quite accurate.
I think I can share a little bit. From my perspective, like I said, during masters, I was exposed in SPSS and wanted something which is not so technical. So Jamovi is user friendly. That's one thing. And R, to be able to use R, I felt that I needed some coding background to be able to use it. So that's how I ended up in using Jamovi. And whether we can learn it easy, I think it's very easy, because like when I was in UM, we never had classes. There was no classes. Our biostats, we didn't learn Jamovi from university. It was a self-learning platform. Another option besides YouTube and all is that website itself, jamovi.org. A lot of information can be available from that website. So I think that would be a very helpful website, and everyone can easily use it for your analysis.
I would like to add in some more. Speaking from those who have experience from both software, I personally think that regardless whether you use Jamovi or SPSS, first thing when you want to transition to R, ideally you need to familiarize with the syntax, because R is purely syntax. If you don't, I come across many like medical doctors, right? When they look at the syntax, they straight away get panic because how complex it is. So if you transition for SPSS or Jamovi, ideally you open out the syntax mode, try to understand each line of the syntax so it can transition smoothly when you go to R. This from my perspective. Yeah.
Okay, thank you very much for the speakers for the input. Okay, we have two questions currently. First is from Alia. So the question is, what are the data cleaning features that Jamovi can do? So I open to any speakers to answer. Maybe I give to Mr. Ng to answer the question, or Dr. Wong. The data cleaning, what are the data cleaning features? Because we are talking about a lot of data analysis just now. So maybe, for like the beginning stage of the research where we need to clean data, is there any advantages or any features that Jamovi can help for cleaning data?
Thank you for your question. As far as I'm concerned, based on my experience, the first thing you have to do is just to do the simple exploratory data analysis to check whether you got any outliers or not. That one is to deal with extreme value. As for the missing data, if I'm not mistaken, currently Jamovi, they have one add-ons, they have the imputation, misarranger imputation. Let me look at which module. I would like to share the module that have the module is called BSS. They have the misarranger imputation, which extremely useful to deal with missing data, which quite common happen when we do any kind of data analysis, especially you deal with secondary data, whereby missing values are relatively common. Yeah. So I hope I answer your question, Miss Alia.
Okay. Any speakers want to add on, or we can move to the next question? Okay, the next, yeah. So you want, sorry. So next question, how do you compare with Datu Agassi bin Muhammad Kamal? How do you compare Jamovi with GraphPad Prism? So I never heard of GraphPad Prism. So I think any speakers maybe had experience with GraphPad Prism, and how does it compares with Jamovi? Dr. Wong?
Actually, I don't have much experience with GraphPad. Maybe Mr. Datu Agassi can tell us more about the GraphPad Prism. Actually, what is the main function of this software? Whether you just churn out the quality, visualization, graphic, this kind of
Hello everyone. I just want to share because
Yeah.
I never used Jamovi. I use SPSS and this GraphPad. GraphPad is it's more towards, I mean, like usually researcher doing preclinical most likely will use this GraphPad. Like it's kind of user friendly as well, and it can generate its own graph and graphic as well. But yeah, I know that none of you use that, so I can't get any opinion. It's okay, but then it's very good talk today. Thank you, everyone.
Sorry, Dr. Agassi. Speaking about GraphPad Prism, I have experience looking at that before. Because some of my colleagues actually use that. One of the most obvious difference is GraphPad Prism, you need to pay. Jamovi, you didn't need to pay. That's the most obvious differences between these two. So since Jamovi is an open source and they are linked to R, right? So you will definitely get much more module and add-ons compared to GraphPad Prism. Yeah, I hope I answer your question.
Thank you so much.
Much, Dr. Wong and Mr. Ng for sharing, and also Dr. Agassi for sharing as well. We have a new knowledge today about GraphPad Prism. Yeah, because when I Google, it says pricing, so there definitely it needs to pay. We need to pay for that lah. Okay, so I think there's no more questions. So our participant, Ahmed Aziz Hassan, share about this book to learn statistics with Jamovi. So we can try to open it and learn from it. So I think we have reached at the end of our program. Allow me once again to extend my heartfelt gratitude on behalf of the organizers, which is the Digital Health Science Unit USM, Malaysian Association of Epidemiology, and PIC, Persatuan Anggota Kesihatan Kelantan. A very big thank you to our speakers, Dr. Wong Min Fui, Dr. Rowena John, Mr. Ng Yit Han, and Dr. Marhaini Mostapha, for spending their time with us today to share their knowledge and experience on Jamovi. And also, personally, I must say that after listening to all sessions, I'm convinced to use Jamovi myself, the way it simplifies analysis while still offering powerful features and the integration with R is really beneficial for us researchers, students, also practitioners. I would like to remind everyone to fill in the registration link for the MMA CPD points as well as certificate and also material sharing. And I have a message from the organizers as well. So you can register for the Malaysian Association of Epidemiology. You can see the website there, epidmalaysia.org, and also Persatuan Anggota Kesihatan Kelantan, pic.org.my. Even though you are not Kelantanese or what, but you can still register because PIC, from my experience, they have a lot of training and also courses it's very beneficial to researchers and students. We have an upcoming event in 9th of October, which is we do a art workshop for beginners, art data analysis in art workshop, where we learn about art and art studio. So for members, we will get a discounted price. So it's worth it to register, even though you are not Kelantanese. You can benefit from the courses and training session. So thank you once again also to the participants for the active engagement and also the thoughtful questions. So with that, I officially close to this webinar. So stay tuned for more knowledge sharing sessions from us in the future. Thank you once again. Stay safe and Assalamualaikum warahmatullahi wabarakatuh.
Thank you.
Thank you so much.
Thank you.
Thank you for having us.
Oh, sorry. Can we take a picture? Oh, sorry.
Group
Oh.
picture.
Yeah.
And then also, I would
I
like
thought-
to take this opportunity to thank
Yeah.
Dr. Fitri. Especially, I would like to extend the acknowledgement to Prof. Kim for having us and provide us with this platform to share our knowledge and experiences of using the wonderful software Jamovi.
Okay, let's. Yeah, Prof. K is there in his car. So yeah,
Thank you.
we can all maybe open or switch on our cameras for the photograph. Okay, can we for those who can switch on the camera. I will take the screenshot. Okay. All right. It's okay. Okay. So ready? Yeah. Okay. 1, 2. Okay. Once more. Ready? 1, 2, 3. Okay. Thank you very much, everyone. See you again.
Thank you, Dr. Esther.
Thank
Thank you, Johan and
Prof.
Dr.
Kim.
Marhaini.
Thank
you very
you,
much,
Prof.
yeah.
Kim. Thank you,
Thank you so
Dr.
much.
Fitri. Thank you, everyone.
Thank you.
Thank you, Mama.
Wait.